All right, welcome back to ABA Exam Review and the continuation of our BCBA practice question series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're turning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Teaching a child simple sentences using noun-verb combinations. Dog runs, cat jumps, includes training with 5 nouns and 5 verbs, resulting in practice with 10 specific combinations. Without additional training, the child begins producing 15 novel noun-verb combinations. This example best demonstrates what? All right, so you can see in the beginning, even I stumbled a little bit over reading the question, which happens when we read too fast or if we are just trying to get to the end of it. And we want to try to avoid that tendency, right? Because the most important part of any question is here. We just kind of want to ignore the answer choices until we figured out what's going on in the question itself. Once we've figured that out, then we can look at our possible answer choices. So in this case, we're looking at an example that best demonstrates something. And we know we're teaching a child simple sentences, and we're using 5 nouns and 5 verbs, which results in 10 specific combinations. In other words, we're teaching 10 very specific skills or responses, right? So 10 responses, and that's what we're teaching. Then, without additional training, what happens? The child produces 15 novel combinations. So we've gone from 10 taught combinations to 15 more untaught combinations, right? So when we have a situation where new, novel, untaught responses are occurring, what do we call that? A, generative performance. When you think of generative performance, think of response generalization, okay? It's essentially saying the same thing, where through learning and teaching, the learner can now engage in new responses, even though they were never directly taught those responses. B, stimulus generalization resulting from multiple exemplar training. There was no additional training, right? The only training that took place were the 5 nouns and 5 verbs for those specific combinations. With multiple exemplar training, we're training a lot of different examples, right? And it isn't stimulus generalization. We've got 15 novel responses, right? So we're looking at response generalization. C, response generalization due to loose training contingencies. It is response generalization in a way, right? However, we did not use loose training contingencies. It actually was very structured and systematic. And then D, overgeneralization. Well, it doesn't appear to be overgeneralized because we want more novel noun-verb combinations, right, as they learn. So this example best demonstrates A, generative performance. Baseline data for self-injurious behavior shows high variability between 5 and 25 occurrences with no clear trend. During intervention, data points show an immediate drop with low variability, 0 to 3 occurrences, and a stable flat trend. What does this data pattern suggest about intervention effectiveness? Now, on data graphing questions, you certainly don't have to draw this out, but just because we're practicing, let's just look at what this data may look like. So if we have baseline, right, and here, and it's going to be a very short baseline, but we have 5 to 25, down, up, down, right? It's all over the place. High variability, no real consistency or steady state. But it is self-injurious, okay, so they might have to intervene immediately no matter what. However, when intervention starts, what happens to the occurrences? Well, they drop to nearly non-existent. So despite the unsteady state, we then get this situation where responses following intervention go away. So what's the data pattern suggest about that intervention effectiveness? A, the intervention is ineffective due to variable baseline data. Well, not necessarily, because there was a significant change and the variability steadied out, right? So it does seem like the intervention may have done something. B, the intervention demonstrates possible treatment effects. Sure, it's very possible the intervention had an impact on the self-injurious behavior responses. C, more baseline data is needed before conclusions can be drawn. Not necessarily, right? We can still draw some conclusions, okay? Now, can we say with assurance? No, we can't, right? The only way we would really say with assurance or to be sure would be to reverse this back to baseline, right? But taking more in the initial baseline really doesn't say much. And we still can conclude that it does appear the intervention has some sort of effect on the behavior. D, the intervention demonstrates a functional relationship between the dependent and independent variable. Well, we can't say that yet. Why not? Because we haven't reversed anything, okay? Just baseline to intervention does not demonstrate a functional relationship strong enough for us to make that claim without further testing and further reversals. So what does this say? The intervention demonstrates possible treatment effects. You receive a phone call from a client's grandmother requesting updates on treatment progress. The grandmother is very involved in the child's life and often attends sessions. What should you do? All right, very straightforward question, right? Long test, a lot of questions. Not every question is going to be lengthy. They're not all going to be hard. Take each question by itself, okay? Don't go in anticipating or trying to anticipate what you might see. In this case, you get a call from a client's grandmother and they want updates on treatment progress. They're very involved in the child's life and often attend session. What should you do? Now remember, on our exam, we want to treat ethical and privacy scenarios by the book, okay, as black and white as possible. So this grandmother is requesting treatment progress updates, which is private information for the client. So how should you respond? A, provide the information since the grandmother is involved in treatment. It doesn't say she's involved, it says she's in the child's life and attend sessions. We need to know for sure we can provide these updates on progress, the data, for example, before we actually do it. B, provide general information, but withhold specific details about behaviors. You don't even want to go that far, right? Before we give any of the information that may be private, we have to be sure. C, verify the grandmother is listed on the authorized release of information form before sharing any client information. Yes, and it seems obvious, but on the test, the ethics a lot of times seems too obvious, right? Because in real life, things don't always go according to plan, so to speak. On the exam, we need to play exactly by the book and what we should do. D, refer to the grandmother to speak directly with the parents. No, we just want to verify grandma's on an authorized release of information, and once she is, happy to provide updates. Training staff to implement discrete trial teaching involves different approaches. Staff member A receives a detailed task analysis, watches a demonstration of each step, and immediately practices with feedback. Staff member B observes multiple sessions with experienced therapists working with different clients over several days before attempting the procedure. Both successfully implement the procedure. What statement best characterizes these training approaches? The previous question and this question really couldn't be more different, right? This is extremely wordy, lengthy, and what tends to happen is you see a short question and you get excited because it might be easy. Then you see a long question and you kind of start to get anxious. Try to get rid of all that and just treat each question like you're approaching any other question, regardless of length or word usage or anything. We're just trying to get the right answer on the question in front of us. So we're looking at the training approach that characterizes, or what characterizes these training approaches. Now, we have training staff who were training staff to implement discrete trial teaching. Staff member A is getting a task analysis and a demonstration and gets feedback. Staff member B observes sessions and then works with different clients before attempting the procedure. Okay, so not a lot to go by, but what does it appear staff member A is doing if they're getting a task analysis, watching a demonstration, and then immediately practicing with feedback? What seems like they're trying to model, right, or imitate what is happening. Whereas B, they're observing, okay, other therapists working with different clients before attempting the procedure. And this goes on for several days. So we have a situation where it's immediate and a situation where it may not be. So let's look at A. Staff member A received imitation training. Staff member B received observational learning opportunities. Both can be effective, but observational learning may produce better generalization across context. Okay. B, both received imitation training since they both observed models. The only difference was the timing of practice opportunities. True imitation has to occur immediately, and staff member B is not doing it immediately, therefore it can't be imitation training for staff member B. C, staff member A received observational learning, staff member B received imitation training. We said we already ruled out imitation training with B. D, both received observational learning. Again, no. Why? Well, A gets a demonstration and then they practice immediately and get feedback, okay? Imitation and observational learning are different typically because of the immediacy of the behavior and the consequences and either the observation of the consequences or experiencing the consequences, okay? So they're similar in that we're watching someone else and learning that way, but they're different typically because of the immediacy. So in this case, staff member A received imitation training. Staff member B received observational learning opportunities. Both are effective, but observational learning may produce better generalization across context. Working with a student in a school setting, the teacher requested you implement an intervention during recess that would require the student to miss social opportunities with peers. You believe this could be detrimental to social development. How should you proceed? All right, let's think about this, right? How are we going to proceed? We're working with a student at school. Teacher wants you to implement an intervention that would cause them to miss social opportunities, and you think it'll be detrimental. Okay, pretty straightforward. Now, a couple things to consider. One, yes, we're working at a school with a teacher, so different environment, not necessarily our environment, so we need to absolutely respect and collaborate with this teacher. Two, just because you're working in a different environment or you're on a contract or whatever it may be, you still have to abide by our task list and ethical code. So if you think this is detrimental, we can't just go ahead and do it without something first. So how should we proceed? A, implement the teacher's request since the teacher has classroom authority. Maybe she does, but if you believe it's detrimental, we need to try to collaborate first. B, refuse to implement the intervention and document the teacher's inappropriate request. Well, we're going too far the other way, right? It is her classroom, and so it's her choice, and she can guide you. But what we need to do before going along with it is discuss our concerns. We've got to try and collaborate. We can't just stand by silently getting upset about something we don't agree with. D, implement the intervention as requested, but reduce the frequency to minimize impact. Before we do anything, collaboration, collaboration, collaboration. You've got to try and collaborate. Thanks for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout-out. Work hard, study hard. See you soon.